Medical doctors need to get a grip when it comes to their salaries. The average physician in the
So are doctors overpaid? I'm Dr. Mem. I'm a board certified allergy doctor and obesity doctor. And essentially in this long video, he talks about how doctors are very highly compensated, which is true. Doctors are in the top 1% of salaries in the US. And there's a bunch of videos of other doctors trying to defend why they should make a lot of money or how hard it is to be a doctor, et cetera, et cetera. I'm not going to talk about that. I'm going to contextualize why doctors make a lot of money and why certain specialties of medicine make like triple or quadruple what their counterparts might make. Let's start with the highest paid. We start with neurosurgeons, thoracic surgeons, orthopedic surgeons, all these different types of surgery specialties. Now notice, I'm an allergist and I'm not in the top 20 highest paid. We're going to come back to this list, but one thing to notice is that these are all highly procedure-based specialties. How many hours a week does a doctor work? As you can see, the majority work 50 hours or more in a week. And these are not residents, these are attending. So these are after they finish training, how many hours they might work in a week. So the question is, how is a doctor actually paid? So let me break it down for you. Essentially, the doctor sees a patient and then they bill a code depending on what they did for that patient. They could do an office visit, which is called an E&M code, or they could do a procedure. For me, for example, it might be an allergy test, doing allergy shots. For a surgeon, it could be doing a whole-on surgery. Now, fields that are procedure-oriented make more money because, in general, insurances pay more for procedures than they do for your time sitting with a person. Now, one thing that's important to know is that a doctor asks to actually see a patient or do a procedure to be paid, and they're usually paid in a delayed fashion, meaning they might be reimbursed 4 to 6 weeks later after they offer the service. That's important to note because none of this income is passive. If the surgeon or the doctor stops seeing patients, the income stops immediately. Which brings up an important point. These doctors can work unlimited hours and there are patients to fill their schedules unlimitedly. So what do I mean by that? If you look at these specialties, let's pick, for example, orthopedic surgery. Most orthopedic surgeons could actually just open a clinic up 24 hours a day, never go to sleep, and they would still have patients filling up their schedules. It's not just that doctors can make a lot per hour, but it's also that they can work a lot of hours if they choose to. And sometimes they have to work a lot of hours because they have to take call. So they might have to be called in the middle of the night, and those are hours that they're going to be paid for. But for the most part, doctors aren't really paid per hour. They're paid per procedure code that they do or per visit that they do. So doctors who make more usually make more because they see more and they do more, either procedures or seeing patients. The second thing to note as a career is all of these have very narrow career windows. If we take a neurosurgeon, for example, starting medical school at 25, graduating medical school at 29, graduating from residency around, 36, first job at 36, they have between 36 and 65, that 30 years essentially, to gather all the income that they can do for their life because this job is too tedious to do in the long term. The irony is neurosurgeons do back surgery and the surgeries themselves, after years, destroy their own backs. So let's say you're like, nah, we want to cut doctors' salaries. Well, how would you do that then? The only way to cut the doctor's salary is to cut the reimbursement for the total code that they get reimbursed by the insurance rate. Okay, let's say a certain procedure is done. This cube is everything affiliated with the cost of that procedure. So the insurance company will reimburse one rate to cover this entire procedure. And when the cost of the procedure might be the nursing staff and the support staff, the actual materials needed, and the logistics for the overhead. Whatever's left over, that's the doctor's salary for that procedure. If the insurance company cuts it by, say, 30%, it doesn't mean the doctor's salary goes down by 30%. It goes down to zero because they're taking only the margins, unless you also want to cut the nursing staff and the overhead and the logistics and the supplies. The insurance reimbursement is not just covering a doctor's fee or salary, it's covering everyone's salary, everyone associated. There isn't a separate billing code for the nursing staff or the MA staff or anyone else. It's one billing code that the doctor does, and then all of that money trickles down. Okay, final 2 points. If you were to cut the physician's salaries, who are you saving the money for? Number one, you're saving the health insurance money, but that's not going to go back to the payers. They're just going to have to use that cost somewhere else. You see, insurances are mandated to use 85% of the premiums directly to patient care costs. But unfortunately, physicians' salaries and the fees that physicians are paid are not a significant enough a portion to really make a dent in your premiums. And right now, private equity is buying out healthcare left and right, and that's where doctors are getting employed and getting their salaries cut. And whenever private equity buys, they just have to they want to take those margins for themselves. So they increase the cost of healthcare overall about 32%, studies have showed, and there's no increase in care whatsoever. So it appears it's better that the doctor actually runs the practice as opposed to private equity. So now a lot of doctors will defend their salaries saying, they have to go into a lot of debt. They gave up their 20s. They gave up a decade and a half of their life. It's a very high stress job. They're dealing with life and death. So it's worth a high salary. I'm not trying to make an argument for or against it, just recognizing that doctors are well compensated, but they're not well compensated passively. They must consistently work actively to make that compensation because they have to build billing codes in order to get the compensation in the first place. And those billing codes are not going straight to the doctor. The doctor usually takes a margin off the top. It also covers all of the overhead, all of the support staff, all of the other staff. When you go into a clinic and you see a bunch of other staff, they're all being paid by those same codes. So cutting those codes affects healthcare at every single stage of your healthcare, not just a doctor's salary. And because a lot of doctors have pretty much unlimited volume that they can see because so many patients are waiting to see them, if they're doing a lot of E&M codes and they're doing a lot of procedures and they're working all the time, they're going to have very high salaries. I hope this explains the logistics of why salaries might be high for doctors, as opposed to me just making an argument on why they should be or shouldn't be a certain way. They're just logistically high because of the healthcare model we currently have and the number of hours usually doctors have to work. All right, hope that helps.